At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend How to Address Stress, Anxiety, and Depression with Diet on Wednesday, June 18th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hey, everybody. Welcome to Dr. Tom Roselle Live. This is yours truly, Dr. Tom, and we're right here, right now on WMAL 105.9, and we're going to talk about things that none of us want to talk about. And what's that, you might say, right? What's the deal here? We're talking about depression. You know, the sad truth is that there's way too many of us that have been diagnosed with depression. And if you go in and you really take a look at that number, you're going to say, how is that possible? How can a country like the good old US of A have almost, actually it can be more than that, 1 in 4 people, 1 in 4. In some areas, it goes up even higher than that, almost 1 in 3.5 that are diagnosed with depression and on some sort of medication. Number one, do you realize the sequela, the ongoing problem with all this medication going into people's bodies? But let's just look at the numbers for a second. Think about those of you who are listening to me right now. How many of you have been told by your doctors that, you are in a depressed state and we're going to take this drug for this and that drug for this, and let's see what happens. And the symptoms, although depressions may occur only, a couple times during your lifetime, they drug you and they forget to go back and re-look at the situation. Today in our live stream program, immediately after this, we're going to get into something called neurotransmitters. And I'm going to kind of emphasize that a little bit because these are the guys that produce your feel-good juices like serotonin, your motivating juices like dopamine, the down-regulators like GABA. These are all neurotransmitters, and they're produced in your intestinal tract. So when you get into that place where you're in a mood that is classified as depression, what really is that? It can be a feeling of profound sadness or loss or even anger. You see more guys that go into this down-regulated, peeled, pissed off mood, if you will, and it all has to do supposedly with depression. Well, the whole idea is, what causes it? We want to touch a little bit on the medications. I'll get more into that in the live stream portion of the program. Now, depression and anxiety disorders are often treated by the medical profession by talk therapy. And talk therapy goes in one of two things. Talk therapy can be, well, what do you think about that? How do you feel about that? That takes forever to come to any kind of resolution, if ever. Talk therapy about what are you going to do about it? Let's put a game plan together. Let's fix this thing, this anger you had because you lost your dog or your father pissed you off when you were a little kid. Let's fix that. What steps are you going to take? Because that was then, this is now. There's a lot of things that you can bring the past up to the future. There's things like called NET, neuro-emotional technique, neuro-emotional flag technique. There's things that you can do with acupuncture. Now, bringing that into perspective and nutrition, on the 18th, coming up very quickly, couple weeks, in-house at the Roselle Center for Healing in Fairfax, Dr. Stephanie Pina, naturopathic physician, and Anna Beth Goss are going to be talking about this subject, and they're going to talk to you about nutritional pieces. They're going to talk to you about dietary intervention. They're going to talk about how each organ system, if you will, can manifest different types of emotional and mental disorders. So we have to understand what it is that we're treating to be able to treat it properly. So join us. You want to register today? You can do it right now while you're still listening. Go online, go to drtomroselle.com or rosellecare.com, and you scroll down, you'll see the link. Just register. The only thing that we ask you, because these are our gift to you, is simply this. If you can't make it, just call and let us know, so we can make sure that we're fully prepared for anybody that does come. And we want to make sure that we give you as much data, as much information as we possibly can give you. So the medications that people are on, if you will, for these types of things are horrific, and the side effects that they have are exponentially increasing the problem. You see something like, let's pick a drug called Roselle, if you will. And Roselle has a problem that it makes life much worse. It's a treatment for schizophrenia. It's used as adjunctive therapy to other antidepressants, so it stacks it on. This is one of the things I want you to understand, that a lot of these medications that they initially use, if you will, for depressive disorder, that ultimately they go into a situation where they can produce schizophrenic-like problems, where you go up and down, up and down. First they say, well, it's not enough. Let's take a little bit more. Let's try this medication. But, here's the deal with drugs like Roselle, right? It increases mortality in older people and people with dementia-related psychosis. Now, a lot of that is simply telling you that if you have an older patient that has dementia issues, right? If you have an older patient with dementia issues and there's already things that are increasing, you run the risk of real problematic conditions called death. Antidepressants increase the risk of suicidal thoughts, and particularly in children. We're seeing more and more young children on all kinds of antidepressants and mood modulators. And subsequently, they're taking themselves out. The rate of suicide, for many, many different reasons, is exponential in today's world. You can have mild things, and those are the ones that they always put out there, like rash, facial swelling, itching, rashes. And then they go, oh, you might have anaphylaxis. If you're allergic to this stuff, be careful because this might happen. Well, how in God's name do you know that you're allergic to anything if your doctor just writes you a script and you're going to be the good, dutiful patient, and you go down to the pharmacy and get it filled, and your doctor says, just take this and we'll see what happens. Doesn't tell you if you're allergic to it. Has no idea if you're allergic to it, right? So I don't know about you, but I think I would be very, very careful and ask a lot of other questions before you get on any of these drugs, because the list goes on, from even potentially causing blood sugar transport problems we call diabetes. It can cause, the unconscious movement of your hands called, tardive dyskinesia. It can even affect your heart. You go into arrhythmia, then they're going to give you something for your arrhythmic pattern, blood pressure irregulation, and so forth. It's the list is horrific. And, we've already got a society that's too fat. And what are we going to do? We're going to look out for weight gain in some of these medications. It's pretty ugly. It can put you into seizures. Now that I've, given you all the reasons that you shouldn't, let's find out more about what we can do about this thing and really understand that depression and anxiety, if you will, are a result of a lot of different things. You could have some genetic predispositions, but that's not the case. It's more, in my opinion, it's familial. What does familial mean opposed to genetic? Well, a genetic means that you got a genetic glitch that is passed on from somebody to somebody else. And so subsequently, you're going to be predisposed to that. But a familial pattern is one where, because you eat like your parents did, you grew up in the environment that your parents grew up in, that there's probably going to be an impact from just hanging out and being with them. It's like, I use the example sometimes. You get a puppy and have them raised with ducks, and pretty soon the puppy starts quacking like a duck, and it starts waddling like a duck, only because of the fact that it was associated with that, right? So if you're looking at, why things happen, are they genetically predisposed? Maybe. Are they more familial predisposed? I think so. And environmentally predisposed and situationally predisposed. So you'll hear me talk about things like every organ system in your body has an emotion, if you will, that's associated with some type of problem with that organ system. Now, you can have energy where your body's dropping down energetically. My world, we're going to look at your adrenal system. We're going to look at your overall energy pathways. That has to do with kidney function and fight, flight, adrenal function. So what's the emotion that might be associated with that? Well, that emotion has to do with your fear pattern or your bravery pattern. And we know when those things are depleted more and more over time, that you become more fearful, if you will, as time goes on. And you go to your doctor, and your doctor decides that, you're going into this fear, anxiety, depressive pattern, and they're going to give you something to deal with it, right? An SSRI, and then, like I said, we'll go into some heavy duty drugs if you don't pull out of that. And in these situations, talk therapy doesn't do a whole lot of anything. Why? Because you're going to sit there with some psychologist and they're going to say, well, what do you think about that? Why do you think it came about in the first place? Wouldn't it be better, my opinion, and what we do in our practice is, what are you going to do about it? Let's put together a game plan. Let's figure out what's going on. Now, that's one thing that you can do. Now, the other piece that I would encourage, particularly in today's world, is looking at the chemistry. Let's take a look at what's going into your body. Let's talk about, the exposures that you have. Let's talk about the lifestyle that you've adopted now over a period of time, that you sit your butt around and you're not doing anything. You're not getting excited about anything. There's nothing to drive you. It's called dopamine expression. So dopamine is a neurotransmitter. Remember I said we're going to get into that a little bit in the next part of the program in the live stream? So neurotransmitters are really critical in making sure that we stay in a good place, that we want to move towards things. We want to get things done. When we're done with it, it makes us feel good. That's a neurotransmitter at its best. And so the dopamine, as you're going to hear me talk about, is about that want to do. The serotonin is about feeling good about having done what you wanted to do. But when we see the number of people in today's world, particularly our youth, that are going into depressive states, we've got a problem. And on the 18th, here at the Roselle Center in Fairfax, we're going to talk about that. Dr. Stephanie Pina and Annabeth Goss are going to walk you through. They're going to give you tools. I'm going to give you a couple today before we're done, and I kind of tease you to go into the live stream with me, because I'm going to give you more there. But when you talk about statistics that have come out, I think it was not last year, 24, but the year before, the data showed that over 40%, or 2 in 5 high school students, are expressing depression. That's huge. Why? Why is that taking place? They're feeling sad or hopeless and they can't get out of it. I don't know about you, but maybe all these crazy people out there that are shooting people as well are in the stage and they're acting out. There's got to be something. The point of it is that it's my job not to judge. It's my job to find out why and to be able to put you in a path. But 40%, 40% of our kids, are in a depressive state. There's something desperately wrong in our society. And a lot of it has to do with biochemical exposures, electromagnetic exposures, talking heads, the crazy people that are out there. But when you get into the suicidal thoughts that these kids are manifesting, and they leave in the morning, and the parents gets a call later on and your child is gone. It's craziness, and it's exponentially on the rise. It's not something that is just been static for a period of time. And then you look at the other patterns, the other things that are taking place because of it. Every function in the body that is motivated by dopamine and serotonin and GABA and hamate, and these are all neurotransmitters, my friends. That's all you need to know about them. Look them up. Just go neurotransmitters and find out what do they do in the body. How do you find them? There's real easy urinary tests to make it happen. And you can resolve so much of this by biochemical changes, energetic changes, acupuncture, low energy light laser, combination of things. Some people have had trauma, injury, things of that nature over the years that will perpetuate and stimulate and initiate these crazy things. The data that is coming down, there's one that I read that came out of Life Satisfaction and Health Data Survey. They said that 1 in 3 high school students reported that their mental health was not good. And they're talking about, how were you in the last 30 days? But when you understand from 30% to 40%, an adult from 20% to up to 29% of all docs, does that seem right to you? Does that seem like it's normal? I don't know about the rest of you, but that rides up my bonnet pretty tight. I don't think so. And so at that point, what are we going to do about it? Are we just going to put people on drugs? Are we going to let our kids commit suicide? Or do we feel like we're going to take ourselves out? We don't want to fight anymore? I think we need to really go after the underlying triggering mechanisms that can make a difference. There was a national survey that they found that a lot of people. I'm going to start with that, right? That suicide is a leading cause of death, the leading cause of death among young people in the United States. And for every American who dies by suicide, many, many others have attempted. And they've ended up in the emergency room. And obviously it's a scream for help. But what they say is that 49% of all people who die by suicide have a history of known depression. It's huge. We have to stop this roller coaster. We have to make sure that we understand how to change this. So if this is the case, and all of a sudden it's exponentially on the rise, what's changed? Our food has changed dramatically. Our lifestyles have changed exponentially. We're on our devices. We're on our pads and so forth, right? The stress patterns, because of all these talking heads trying to scare everybody and say, this is bad, this is not bad, and so forth. Our loss in a belief in the man who made us, God, has gone out the window. My opinion across the board. Now, how many people have made a suicide plan? There's a lot of people who are doing that. We know how many people have committed suicide, exponentially on the rise. But what can you do about it? Well, we're going to cover a lot of that on the 18th. We're going to make sure that you understand how it affects your body physiologically as well. Physiological behavior is an expression of what's going on inside your body and what's being stimulated from the outside as well. Anxiety and depression scale is one that you really need to look at. There's a lot of databases that are out there that will tell you, you got a problem here, my friends. There's stuff that you need to pay attention to. I want you to be well. I want you to make sure that you have the capacity to change and shift virtually everything and anything in your body. We're going to talk about that on the 18th. And, we're going to talk about different herbs that may make a difference. Something like bacopa, extremely, extremely excellent in helping people, kind of regulate. It upregulates your mood by down-regulating all the bad things. But you have to understand there's more to these neurotransmitters than just serotonin and norepinephrine. And just so you understand, serotonin is your feel-good juice, and it enhances mood and energy. Dopamine is what wants you to go do something. It's the attraction that we have to get things done. So we have to understand all those pieces of the puzzle. It's incredibly important that you just don't reach for something that you think might help. Let me take this drug. Let me see how I feel. And they have so many side reactions. For years and years and years in the office, we used ginkgo. It improves circulation flow and increases the neurotransmitter levels in the brain. And it's worked extremely well. St. John's wort, hypericum, same type of situation. You go out and you can do a punch list and you're going to see all kinds of other things that are there. But, which ones are best to do? You got to know which neurotransmitters are down-regulated. But there's a list of them. I mean, you can go in, you can look at even chamomile. Go have a cup of chamomile tea. See how it makes you feel. There's something called American skullcap. That actually is one that has worked well for a lot of people. But you have to hit the right one for you. You got to know what the neurotransmitters are. You have to know whether your body's energetic has flatlined, and that is something that we know how to measure and that we get done. But we're going to talk to you about those things on the 18th. We're going to walk you through the puzzle. We're going to show you exactly what can be done. And we're going to give you tools to make a difference. Dr. Stephanie Pina, many of you know her. She's an amazing wealth of information. She's a doctor of naturopathic medicine. Annabeth Goss, great nutritionist. And the two of them are going to show you what different pieces of the puzzle can be applied effectively so it can make a difference. Now, there's something called lemon balm. And if you have a woman that goes into postpartum depression, it's especially helpful. And for women who are nursing and so forth, and there's no side effects. It won't alter the baby. It won't cause any problems. But it works quite well. Check it out. Go online and work with your doc and say, hey, do you have a problem if I take this? There's really no side effects to it. And, you take lemon balm tea, nice and easy sip on it. It seems to ease anxiety and depression. And, it's been used, again, one of these things that have been out there for a long time. You can put lavender into a diffuser, and you'll be surprised how you feel in the morning when you wake up. If you're suffering from even insomnia and, really tight anxiety in the morning, you'll find that you'll wake up feeling a whole lot better. Okay, we're getting ready to follow me into the live stream. We're going to continue the process of talking. And remember, every Sunday, I'm here giving you a little different look at the problems that we face on a day-to-day basis, but more importantly, how to fix them. I'm here for one reason only. You deserve the information, but more importantly, I love you all. Have a great Sunday. Follow me now. Let's go.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend How to Address Stress, Anxiety, and Depression with Diet on Wednesday, June 18th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com. Neuromuscular dentistry is more than just teeth and gums. Neuromuscular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live. If you're in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Visit softtouchdentalcare.com or call 703-319-6990.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.